Well, hello and welcome to today's episode of Breaking the Taboo. And today we're going to be speaking about birth injuries, which is something that many listeners have been getting in touch to ask more about. And that's something that I myself have suffered from. I suffered from a third-degree tear as a new mum when I gave birth to my daughter. And to be honest, I didn't really know anything about birth injuries before I suffered my own. And that's why with me today I've got Chloë Oliver, the Chief Executive of the birth injuries charity, the Masic Foundation, and also another mum, Sarah Embleton, who's going to talk about her lived experience and hopefully provide listeners with a bit of advice if you're worried about, firstly, how to prevent a birth injury in the first place, but also to get some practical help on what to do if you are living with these symptoms. So, Chloë, could you just introduce Masic to some of our listeners and the fantastic work that you do as a charity? And I have to say, I came across you first as a mum online, and I know what great work you do, but it'd be great to tell our listeners more about your work.
So the Masic Foundation is the only UK multidisciplinary charity to support women who have suffered perineal injuries during childbirth, also known as obstetric anal sphincter injuries or third or fourth degree tears. We aim to raise public awareness of injury, in particular the long-term emotional and physical impacts of injury. We support injured women, we support research and prevention, and we educate and work really closely with clinicians to raise awareness of injury, the causes, the treatment and the symptoms, and the impact on injured women themselves.
Well, thank you so much for joining us today. And Sarah, you very bravely come on today's show. Would you mind sharing a little bit about your personal experience and why you're here to talk about birth trauma today?
Of course, thanks, Theo. So I'm a Masic advocate, so a mum who sort of helps to raise awareness with the charity, and I'm also a trustee of Masic. And I suffered a third degree tear back in 2011, but it was undiagnosed at the time. So I didn't actually know I had that tear until about a year later. So of course that caused me lots of issues, both physical and psychological, which continue to impact me today. But I'm really passionate about raising awareness of these injuries and helping other mums who've gone through things to access help and support, because I really struggled to do that. Sort of in 2011, there wasn't really that much around that I could find. So it's a real passion for me to help drive that.
And I think you make a really important point there, Sarah, about you were actually sent home with it undiagnosed. So perhaps we could start off with this point about kind of what is a birth injury? What are the type of symptoms that mums should be looking out for? And Sarah, perhaps you could start off with just sharing us what were the things that you noticed were a bit wrong when you went home with your newborn baby that made you feel you needed some help?
Of course. So it varies obviously from person to person, but there are quite a few things that are often present and consistent for people who have these sorts of injuries, particularly if they haven't been diagnosed. So obviously there's a lot of pain around, when you give birth, there often is a lot of pain. But when I went home, I was in what felt like a disproportionate amount of pain that wasn't being managed by the drugs. Also started to experience difficulties with going to the loo. So a lot of mums report that they're constipated because they have a lot of drugs during birth and that kind of thing. Everything's impacted. But with these kind of birth injuries, you can often have a mixture of those kinds of symptoms. But then when you do start going to the loo, you can have urgency. You can often have accidents and not get to the loo in time. Often mums have things like flatulence, wind that they didn't necessarily have before. And I just had a real sense that everything wasn't as it should be. But one thing that also happens a lot to women in my experience and speaking to other women who've been affected is that you're often told that these things are just common when you've given birth. So you're told that it's normal, that it will calm down, that things will settle down. So it's kind of often a normalised thing. So you're experiencing these quite distressing symptoms, but they're often normalised, particularly as well by medical professionals in my experience. So GPs and health visitors often will say it will get better.
Yeah, that's such an important point, and absolutely related to what you just said, Sarah, there. I remember the first time I think I went to the loo when I got home. I think I was absolutely terrified that everything would just fall out because, nothing is working properly as it should. And you don't really know what is normal. And you look online, which is always a terrible thing to do, to look on Dr. Google. So that's why it's great to have you guys here to sort of answer those specific questions. So Chloe, you come across obviously a lot of mums through Masic who've had similar symptoms to myself and Sarah. Could you just talk us through, you mentioned the obstetric anal sphincter injury, but for people who are not aware of what that is, could you just explain in a bit more detail that the types of birth injuries that people might have?
So obviously, when your baby's being born, your vagina stretches, and sometimes it can't quite stretch enough. So if this happens, a bit between your vagina and your back passage, your perineum might tear. And lots of tears are very minor. So we call these grade 1 and 2 tears. And grade 2 tears can be stitched by the midwife in the same room. And although really sore, will heal. Grade 1s are kind of, minor sort of grazes to the skin. And again, although very sore, will heal by their own. So it's important to note that most tears are very low grade and will heal and everything will be fine. But grade 3 and 4 tears are more serious. And this is where the tear extends into the anal sphincter muscle towards your bottom. And these need surgical repair. And what's really important with these tears is that they are identified at birth. If they are identified at birth and repaired, there's a really good chance you'll make a really good recovery with support. There may still be issues, but at least, they're identified, repaired, and then you can be on a pathway of care to support you and help you recover. What we see is that some repairs, as Sarah mentioned, some tears are missed. And that's where lots and lots of problems also happen. So there's kind of 2 pathways for women really who suffer these tears. It's identified and repaired. And, there's a pathway there of symptoms and, being looked after and managing that kind of repair and that injury going forward. But then there's another pathway that we see, which is very distressing, where your tear isn't identified and repaired. And you go home and all of a sudden these horrible symptoms happen that you can't control, your poo or your wee or your wind. And, that's really distressing. And I think, as Sarah mentioned, it's really important that we don't normalise this, that, if you have this kind of symptom at home, you need to seek help. And we know that's difficult. And there's varying kind of awareness of injury. So that's one of the other kind of issues we see. So a woman has had perhaps a very traumatic birth, she suffered this injury. It's very hard then to go and advocate for yourself and go and speak to somebody. It's really embarrassing. You're in that period, you've got a new baby, you're suffering really unpleasant symptoms. It's very stressful, but it is important to go and seek help.
I think that's such an important message. And Sarah, when you were sent home, you obviously didn't know that you had a tear. What was the moment that made you realise something was wrong, and what did you do?
It's a really interesting question, because I think there were many moments where I knew something was wrong, but I was in denial myself, I think, because as well as being told by various medical professionals that I was okay, I was focused on my baby. So I was putting myself very much in the background. So it probably was about 9 months in when I remember going on holiday with my partner, and it was really the first time that he'd really seen just how I'd adapted how I was living and how I was existing, because I was being governed by needing to go to the loo. And I think at that point we had a conversation. I remember thinking, this really is not right. It really isn't right, and I cannot go on like this. And coinciding with that was I was returning to work at 12 months after having my son, and that was a real mind focuser as well, because I thought, how am I going to do this? How am I going to go to work with all these symptoms? So that was a turning point for me. I knew things were wrong, but I really didn't pay attention to it as much as I wish I had done. So one of my other messages would be, if you know that something's wrong, please try and seek help as soon as you can, and try not to lose confidence if you do get sort of fobbed off really by people.
And I think that's a really important point, that kind of, knowledge is power. So us talking about this today and saying that if you think something's wrong, it might well be. So definitely ask. So Chloe, firstly, is there anything we can do to prevent birth injuries in the first place? And I think it's really important to say that obviously Sarah and I had unlucky experience, but a lot of mums, who are listening should know that they will give birth and have a good experience. And we were certainly in the minority of mothers who will have experienced a severe tear. But is there anything they can do ahead of birth or during labour to try and reduce it?
So I think the first thing is at the antenatal stage, just having an understanding of the risks and about birth, and discussing with your kind of midwife your risk factors. There are some risk factors for injury. So first-time mums, being of South Asian heritage, if the baby is big, if the baby is in poor positions. So, identifying the risks in advance so the appropriate steps can be taken is really key. And that's something that needs to be discussed with you and your healthcare provider. There are advocates for perineal massage, which in the antenatal stage. But also there is something called the OASI Care Bundle, which is implemented in some hospitals. So that's a package of care that looks to prevent injury. And it certainly contributes towards a reduction in injury. So that's hands-on methods, so guiding the baby during birth in a slow and measured way. If you do need something called an episiotomy, so that's a cut that's indicated at a certain angle. And one of the most important parts of that package is, if you have had a tear, doing a simple exam to see how far that tear is extended. We can't emphasize enough, it's really important that we identify these tears if they have happened, so they can be repaired and that mum can be looked after. So again, I think in that stage before you have a baby, it's just really key to just understand the risk factors so you can consent to any types of treatment during birth. And what we see is that many women who've suffered an injury are just in this absolute state of shock and disbelief because they didn't know this was a thing, that this could happen. And actually, if you know this might happen, if you're prepared, and there's this fear that, if we tell women the risk, that it will scare them. It doesn't scare women. It empowers us. It helps us make informed, consented decisions. And that has a huge impact then if it does happen, that you understand why and you can make then decisions and advocate, afterwards for your kind of care. So I think that's really key.
And I think you make a really important point there about consent. And I certainly felt as a new mum in hospital that I just didn't really know anything about what to expect. And I certainly didn't understand the different risk factors. And something that I heard in Parliament when I chaired the birth trauma inquiry looking at maternity services across the UK was hearing about how things like use of forceps had actually increased the likelihood of a birth injury. So could you just talk a bit about that informed consent point? What should mums know so that if they're presented with a choice during labour, that they are making a decision aware of what the risks might be?
Again, I think it's, in that stage before you give birth, having an understanding of what birth might look like, what might happen. So as and when, because we all know during childbirth, it's very hard to make informed decisions. That is not the time and the place to have a really serious discussion with a woman about what, should happen and do they might not happen. These discussions should happen before. And last year, we did a piece of work, a survey of women who'd had what we call assisted vaginal birth. So that's forceps of 1-2s to help them with the delivery of their baby. And, many just didn't feel they had enough information about that to make an informed decision. And that's really key. So having an understanding of, the risks and the benefits of assisted vaginal birth. So as and when that might happen, you can make an informed decision with your healthcare provider.
Yeah, that's so important. And Sarah, you talked there about the challenges of obviously being on holiday, being out and about, thinking about going back to work. So just explain to us in a bit more detail what you mean. I mean, for myself, I think it was literally planning loo stops. So I'd literally look online and be like, does that tube station have, a public toilet nearby? Could you just talk us through the types of things that you were worried about and the coping mechanisms that you brought in?
Yeah, of course. And it's similar things there. It was, I think I just lived in a constant state of anxiety. So I did not want to leave the house until I had been to the loo, and probably been to the loo a couple of times and made sure that I'd been, and hopefully that would carry me through for a few hours. But it was the fear of knowing that it might not, and that I might have an accident somewhere, because obviously when you have that urgency, I think what I lost was any ability to control the need to go to the loo, and also to stop the need. So how I would sort of say it is that, in inverted commas, normal people, or people who don't have these kinds of injuries, have an ability to say, they could be sitting in a meeting and go, oh, I need to go to the loo, but then they can kind of put it off, and then they can go later when they leave the meeting. But I was in a state where it was either I need the loo and it's immediate, or no warning sometimes. So it became absolutely, as you said, where are we going? Are there loos? Is there a loo en route? The eventual destination, is there a loo? Have I got things with me in case something happens? Have I got a change of, underwear, trousers? Have I got everything I need? Yeah, that was the reality. It was also adapting what I ate and drank. Coffee, as a lot of people know, whether they've got birth injuries or not, can be a great thing in terms of encouraging you to go to the loo. So, trying not to drink things that would make things worse, trying not to eat things that would make things worse. Trying to stick to a routine of always knowing I was going to be eating at the same kind of times, so that hopefully I would need the loo at the same kind of times. And I just had to kind of really micromanage how I lived. And I think one thing that I found particularly hard to overcome, and I know having spoken to other mums in a similar position, they felt the same, is to try and find the confidence to keep going, and to keep going out, and to keep having a life and doing the things you want to do when you live in that fear of something like that happening to you. While you're out and about, it's really hard, because psychologically I certainly had a desire to just batten down the hatches, stay in the house, not go anywhere, which is, I think some people feel like that anyway when they've given birth for a period, but it was really heightened. And I think it's a really tough thing to try and get past that, and to say, I'm just going to carry on and get on with things. There are other things you can do as well, of course, like you can take certain things to help you, Imodium, those kinds of things. But it's a really tricky one, really tricky.
And I just related so much, Sarah, to what you were saying. And firstly, I'm so sorry that you had such a bad experience. And I think a lot of mums listening will probably be in the same boat and will be worried about leaving home and going out and about. And I think it's really important to say, don't let your birth injury, control the rest of your life. There are coping mechanisms out there to help you live with the day to day. You talked then, Sarah, about going back to work, and that's something that I think a lot of us stress about. I remember I was in, quite a lot of work meetings with senior colleagues where I'd literally just sort of run out the door in the middle of a presentation, and people thought you were being frightfully rude. But as you said, when you've got urgency, you can't just sit and wait for someone to finish speaking. You need to go now, and you need to go to find the toilet. So how did you speak to your employer about going back to work? And were there any things that they could do to help you?
Yeah, it's a really tough one, and I really feel for anybody who's going through that process, because one of the things about birth injuries, as Chloe said, and the symptoms that you have, you feel quite embarrassed and quite ashamed, and you shouldn't, because it's not our shame, it's not our fault, we've done nothing wrong, but you do, because we don't talk about these things very often in this country. We don't like to talk about our bowel movements, generally speaking. So it's a really tough one. So to bring something that's so incredibly personal into the workspace is so hard. Lots of people have trouble talking to their friends and family about it, let alone an employer. So it's a really tough one. My message would be, if you don't find a way to speak to somebody, you can't expect them to understand or help and accommodate you. So it's really hard. But if you can speak to an employer about your symptoms and what that means for you on a return to work, then hopefully an understanding and sensible employer would help with considering adjustments to make it easier for you to return to work. So, for example, briefly for me, that was I had the flex to come in a bit later in the morning if I needed to. So I knew I'd been to the loo and I could get on with my day. And you know, as you say, Theo, people understanding sometimes you might need to dash out of a room. I mean, that's hard in itself, isn't it? Because you might be happy to tell your boss, but you don't want all your work colleagues necessarily knowing what's wrong with you. So it's a really, really tough one. And obviously different people will be in different situations depending on what the needs of their job are, and whether they feel they can speak to their employer about it.
And I think it's really important that we have this conversation. I mean, I called this podcast Breaking the Taboo because I think we do seem to feel shame and embarrassment about speaking about it. And I hope that by people like myself and you, Sarah, and others, sharing our stories, that they can feel that, you're not alone. There is help out there, and don't feel embarrassed to ask for help. And I think most employers will be accommodating. You just have to ask. And I think it's kind of breaking through that fear barrier that you can't ask. But actually, that will be the thing that will most help you to transition back to going back to work. And I also just want to pick up on this point about anxiety, because we've talked a lot about physical symptoms post-childbirth, but if we could talk a bit about the mental health as well. So, Chloe, the mums that you engage with at Masic have come from sort of all different experiences, but are there sort of certain symptoms which are coming through in relation to birth trauma more on the mental health side as well? And what kind of support is out there to help?
Absolutely. I think that so many of the women we speak to are just in shock, feelings of isolation, anxiety, again, this not knowing something like this could happen, and not, the impact cannot be underestimated. The emotional, physical, mental impact it has on your, day-to-day life and ongoing, long term, is just awful. And it's then very hard to seek help and to talk to people when you are suffering these feelings of anxiety. You might have PTSD from the birth. You might have postnatal depression. It's really hard to then go and speak to anybody about this. So that reinforces the feelings of isolation. And again, this is why it's so important we keep talking about it. And we know actually one of the most powerful things we do as an organisation is when advocates and women talk about their other experiences, women reach out to us and say, oh my goodness, I heard X speak. I thought I was the only one. I've never spoken to anybody about this. And we have women who come to us years later who've not spoken to their partners about this, who've hidden their symptoms, who have disappeared from life, who haven't returned to work, and a job they loved, which, is a huge loss of self-identity when you can't return to what you loved before. They just disappeared and they managed their symptoms in private and shame and embarrassment. So it's really hard to reach out. But we know when we speak about this, women reach out. And that's a real key theme, this kind of feelings of shame and anxiety. And then it's very then hard to access, a sometimes very complex healthcare system when you feel like this. For women who, if we have a series of really successful educational webinars. So it's important. We have one on employment, actually, returning to work, which we'll post a link for, which is really important to look at. But we have a really good online support network. So please do reach out to us and we can connect you with other women who are feeling exactly how you feel. I think that's really important to understand that you're not the only one. Women on our kind of support networks share and support each other. And that really does help.
Absolutely. And I think this theme about back to work is such a big topic. Maybe I should do a whole separate episode just on that subject. And maybe we'll get a lawyer and kind of give everyone some advice on, what to do in that scenario. So just continuing on this theme of mental health. Sarah, did you get any help with your symptoms? And what kind of thing helped you as a mum's experiencing that?
Yeah, I did eventually get some help. So I had both physical help. So I had some treatment to try and help me with my symptoms. From a mental health perspective, I would echo what Chloe said. I was full of anxiety. I was probably depressed. I didn't get a diagnosis of depression and I didn't take anything for it, but it took me a long time to sort of pull myself out of the fug of how I was feeling. And I had diagnosis as well, PTSD, adjustment disorder. And I think the main thing for me was trying to access counselling support. That really helped me. And I appreciate that's a tricky thing because it's hard to get that help on the NHS for a lot of people. And, you know, it's difficult if you have to try and find it yourself. But I think any kind of, anecdotally from other people I've spoken to as well, these kinds of injuries, being able to talk to somebody about it and being able to process, importantly, process what you've been through and process the trauma, so that you can hopefully, you know, live with it and move forward with it, is so important. But there are lots of different ways of sort of coping and accessing care, and I know there's a lot of support about that on the Masic website as well.
Yeah. And just listening to what you were saying there, Sarah, it reminds me of, you know, the over 1,000 stories that I read of mothers submitting to the birth trauma inquiry. And a lot of them said to me, you know, that they were basically exhibiting PTSD symptoms, but they didn't think they had PTSD because, of course, they associated that with, you know, army veterans who'd been to war. And they said, well, I've just had a baby, so it can't be that I have that. And actually, I think it's really important to say that if something very significant has happened to you during childbirth, I mean, you know, I myself thought I was going to die on the operating table in the middle of surgery for, you know, recovering from my tear, that actually that can cause PTSD. They don't have to have been in a conflict zone to experience the same symptoms.
Yeah, and you often feel, again, well, I certainly felt, I know other people I've spoken to have said the same, the shame that I mentioned about the symptoms. I almost felt ashamed of that diagnosis, like as if I couldn't tell people that because they would think, well, you're not a soldier from a war zone. So I felt almost myself, it took me a long time to accept that I could suffer from something like that, because it just didn't see, how can you have a child? How can you go and give birth and have that as an outcome? It just didn't seem possible somehow.
Very, very true. And something you also mentioned, Sarah, was obviously the impact on your family and your partner. And I'd just like us to delve into that in a bit more detail because, you know, a lot of dads have surprisingly written to me in the last few months since I started my campaign on reducing birth trauma. And they are obviously quite terrified when something goes wrong and suddenly they're looking after their mum, who's got a newborn baby as well to look after and is obviously not right. And they want to give them support, but they're not entirely sure what to do. You know, what would the mum like them to say in that scenario? So, you know, when you had that kind of frank conversation with your husband when you went on holiday, what was he worried about and what could he do to help?
I think part of the problem of having that conversation or being really honest about it was that although he was incredibly supportive, he had his own feelings of guilt and so on that he was dealing with. Because I think quite often the person who's present at the birth with you or the partner might feel that somehow they're responsible because they didn't know this could happen and you couldn't advocate for yourself at that point, so they should have done. So I think it's quite common for partners to have their own really difficult feelings to deal with as well. So even the most supportive partner might struggle themselves as well. And I think we don't really think about that aspect of this very often. We tend to focus on what we're going through, what the woman's going through, quite necessarily. I think just really just understanding and talking and communicating and talking about what's happening between the two of you, if you can, is so important so that you both understand where you're at and what the impact is, because it has huge impacts on all your relationships in my experience, friends, family, partner, often with a baby. So for me, communication, if you can talk to people about it and try and explain how you feel and also what you need from people to the extent they can provide it is key.
And I think it's so important to start that conversation. I think the first person you tell is always the most difficult. I think the first person I told was actually not my husband. It was a medical professional, because it's almost sometimes easier to talk to somebody that you don't know who's at a remove. So I don't think it matters who you tell first, but I think once you've kind of broken through the shame of talking about it to somebody, then you realise that you can get help. But I do think it's really important to speak to friends and family so that even if they can't relate exactly to what we're going through, that they can understand ways to help us and support us. So is there anything on a practical level that you think that dads should know? Because we do have fathers listening to the podcast and they want to know how to support the mums that they're with. So any advice for them?
I think one of the things that they could do is, as you said, I think at the beginning, Theo, knowledge is power. So there are resources out there now that people can delve into and get support from organisations such as Masic. And I think trying to understand what the impacts are and potentially how to access help and sort of arming yourself with knowledge. If you want to support somebody, that can be a powerful way to sort of inform yourself first, to the extent you can, and then have those conversations.
Yeah, I think that's such important advice. And Chloe, is there anything that you'd recommend for friends or family listening who want to support an affected mum with a birth injury?
I think listening, is absolutely key. Listening, that sympathetic ear, there's lots of information on our website and out there now, which is great because obviously the more we talk about this, the more everybody understands that birth injury is a thing. It happens, and that's really key. So when somebody does say to you, I've suffered this, you're not starting from a completely blank space of not understanding. And, I've heard of that. I understand. And it makes it easier for us to have this conversation. And let's not be embarrassed. Let's talk about this bodily functions and, childbirth. This happens. Let's not be embarrassed. Let's be open. Let's talk about it and just listen. And yeah, there's lots of information out there now on our website about injury and how you can help. And I think just being a sympathetic, positive ear, because having a birth injury, there is a significant long-term impact. It doesn't go away. It impacts you all the time. So having that kind of patience with somebody who has suffered a birth injury and just being there is so important.
That's such good advice. And you just reminded me there, Chloe, as well, that, just because you had your birth maybe a long time ago, don't think that that was too long ago to ask for help. So it doesn't matter whether you gave birth, in the last few days or last few weeks or last few decades. We've had mums write into me who've said that they didn't feel they could talk about it to anyone for pretty much, half of their lives. And hearing this show or hearing me speak about it in parliaments has made them realise that they're not alone. So I think it doesn't matter when it happened to you, know that there is help out there and to ask. And we've talked a bit about families and the mums, but also we do have healthcare professionals interested to know how they can better support affected mums too. And I personally feel there seems to be a bit of a knowledge gap as well, sometimes with the GP or with the health visitor. I remember when I had my 6-week appointments post-birth, that basically my GP really didn't understand what a tear was, also didn't have access to my hospital notes because it was a different database. So I'd have to go through the same process again of describing my symptoms and saying what had happened to me. So is there anything that we can do to sort of decrease that knowledge gap and make sure that healthcare professionals are also providing the support that mums need?
I think, again, talking about this, raising awareness, we know there is the positive is that the perinatal pelvic health initiative that's being run across hospital trusts is a really great piece of work amongst secondary healthcare. So women within the first year of giving birth now, if there was some kind of perineal trauma at birth and they are suffering from incontinence or prolapse, they are being signposted these services, and I believe some are self-referral. So that's really good for those women, because we know that getting on a good pathway of care is really difficult. And we are seeing many healthcare professionals reach out to us asking for advocates to come and talk at their services about the long-term impact of injury. I think it's important to know that midwives only see you for a few weeks post-birth. They don't see women in the months and years later. So there is a lack of understanding of the long-term impact of birth injury, but that's changing amongst those initiatives, so that's really good. But yes, from a primary care point of view, there is varying knowledge of birth injury amongst GPs and healthcare professionals, and especially for women who perhaps have had a missed tear or have had symptoms flare up over years. We know that when you hit menopause, you might suddenly start suffering symptoms that perhaps you didn't know from an injury you sustained years before. And we see all the time women who've gone to their GP who just didn't have any knowledge of birth injury. And can you imagine, you've plucked up the courage to go and speak to somebody for the first time and you've been dismissed. Your symptoms have been normalised. We had somebody, I spoke to somebody a little while ago. She was told, women just get lazy after childbirth. We've had incidences where, birth injury doesn't happen here. That happens in third world countries. Or perhaps you're not very clean. We had a lady who was told it was her poor personal hygiene. So imagine you've really plucked up the courage to go and speak to somebody, and that's what you've been told. So I would say some bits of advice on our website. We ran a very successful research project with Warwick University that involved speaking to GPs at various different stages in their careers and injured women. And we've looked at some advice and training packages. So there's a really lovely piece about how to speak to your GP on our website that I would recommend people go to. And we also advise women, when you go to your GP appointment, get the Masic website up on your phone, show them. Because, the birth injury is a condition with significant impacts. And then, we also advise women who they might ask their GP to refer them to. So that might be bowel and bladder clinics, colorectal surgeons. Again, why would you know about these kind of things? But you're having to advocate for yourself and ask who you need to be referred to. So there's information out there and we can advise on that, and keep going. It's just so important. There are some really great GPs, but there are gaps in the knowledge, and we're working really hard to change that. And again, this is why these conversations in public are so important, that it reaches and fills in those kind of gaps in knowledge. And there's lots of great work going on amongst healthcare professionals to raise awareness of injury and its impact. But, there's still much more we need to do.
Absolutely. And, I myself went to speak at university the other day to some student midwives, and they were really interested to hear about, my experience as a mum with a birth injury, because it wasn't something that they were as aware of. But now they know how incredibly important their role is, when the baby's coming out, to help us to have less symptoms. It's something that's really important to be speaking to healthcare professionals as well as families. I always like to finish off the podcast episode with sort of 2 questions for all my guests. And the first is, I want us to be really practical to help affected mothers. So, Sarah, firstly for you, what would be the one piece of advice that you'd like to signpost any mum listening today to, that you wish you'd known when you suffered from birth trauma yourself?
I think I've already sort of referred to this, but I would just say advocate for yourself. Keep going and advocate for yourself. Arm yourself with the information. If you're coming up against brick walls with GPs or trying to access care, because I think also there's a real lack of joined up care, joined up thinking. As Chloë said, how do we know if we need a colorectal surgeon or a gynecologist or a urinary person? It's a very difficult area to navigate. So I think knowledge is power. Go to websites like Masic and arm yourself with the information, and then keep going. If you get nothing from your GP, try and see another GP. Just keep going. It can be really, really hard, but the help is out there. And I think advocating for yourself is really important.
Yeah, such good advice. I very much echo that. And Chloë, obviously so much information on the Masic website. I'll make sure that in the show notes for today, we've got hyperlinks to that. But is there anything else that you think mums should know about?
I think I just really echo what Sarah said. My colleague used the word fobbed off. Do not let yourself be fobbed off. It shouldn't be like this, and it's really hard to go and advocate for yourself when you have suffered. You're suffering anxiety or PTSD or postnatal depression from very hard to go and find that headspace and that emotion to go and do that. But let's not normalise these symptoms. Keep going. And we are all working to a place where this won't have to happen. One day, we won't have to advocate for ourselves. It'll be very easy. The knowledge will be there across the board. There'll be no gaps. And, it'll be very easy to access that care. But for now, just keep going and reach out. Do not suffer on your own. You don't need to. There are other women who are experiencing this too, sadly. So reach out to us, to your healthcare professional, to a friend. Don't suffer on your own.
Absolutely. And finally, just a question I like to ask relating to the government and what extra support you think that they could provide. And I caveat that by saying, having chaired the birth trauma inquiry in the House of Commons, it was very clear that there was sadly a postcode lottery on the type of services that we've been talking about today. So, Chloë, if you had, one ask of the Prime Minister to reduce birth trauma and improve maternity care for mums, what would you ask him?
Please, can we roll out the Oasis Care Bundle to all hospitals? The the package is there. So, the work's been done. So let's roll that out. And, alongside that, please roll out all of the recommendations in the report. Let's not delay any further. Let's get those actions.
Absolutely. And Sarah, as a mum living with this yourself, what would you like action from the Health Secretary to be?
Very similar, as someone as well who was involved in that inquiry, and I know how much incredible hard work went into that, Theo. Please look at the inquiry outcomes and recommendations. Try and help women so that we don't have this situation going on and people don't suffer as I did. If the OAC care bundle, for example, had been in place when I gave birth, my tear would have been identified because I would have been examined properly. I would have had a rectal examination and it would have been identified and it would have been repaired at the time. So it is, I know it's hard when there are a lot of recommendations or something, but there are some really straightforward things that could happen, some sort of easy wins that could really move this forward and change experiences for a lot of women.
Absolutely. Well, can I thank you both so much for coming on today? Sarah, you've been incredibly brave to share your story, and I think it makes a huge difference to the families listening to this podcast to know that they're not alone. And thank you, Chloë, for some really practical advice of what mums who are struggling with this can do. So all of the references in today's show will be on my website and also in the show notes. So do reach out for help. Masic's a fantastic charity. I've just signed up myself to become also one of their patrons, and they do fantastic work on supporting mums with birth injuries. And if you've enjoyed this podcast, then please do rate us. Please do share the link with your friends. We want to make sure that we are reaching as many affected families as possible to provide them with the support and the help that they need. So please do also get in touch with us if there are any questions or issues that you'd like me to raise on the show. You can tweet at me or message me on Instagram or TikTok, and our hashtag is breaking the taboo. And you've given me lots of good ideas, ladies, for future episodes. I think we should definitely do something on mental health specifically, and also going back to work. So many more topics to discuss. But thank you for joining us today, and do tune in to the rest of Breaking the Taboo Series 1 on birth trauma. Thanks very much.